Good morning, everybody. Thank you for joining the 7th appointment of the training online in the framework of the Joint Action on Increasing Capacity Building for National Focal Points training program. As you know, as ProMIS, affiliated entity of the Italian Ministry of Health coordinating this joint action, we are leading the work package dedicated to the capacity building of national focal point. It is already 1 year that we have kicked off the training online and also the training on site. The first module has been concluded already. This webinar is opened to all EU4Health national focal points, but not only, because today we are going to deep in another topic, of course, related to health. So we will present the European Territorial Cooperation Programs with a focus on health opportunities. My name is Sandita Florea from ProMIS. I will moderate today's webinar. If you have any question, please do not hesitate to write in the chat. My colleague Pietro Pomella will support you. I will shortly present the agenda. So first we will present, as I said, the new programming period of the European Territorial Cooperation Program. My colleague from ProMIS, Fabio Abrescia, expert of ACTC programs, he will introduce also, let's say, the history of this particular program. We will then also have the opportunity to already have a little Q&A session if any other questions might arise. And then Johanna Stöger from Health Across Europe will present good practice within the ETC project. So the Bridges for Birth B4B project has been funded by the Interreg Slovakia Austria 2014-2020 program. And we believe that it is a good example to be highlighted. And then, last but not least, Mercedes Assi-Torres, Program Manager, Interact, and Team Leader, Inclusive Growth Network, will present the synergies and complementarities between EU4Health and ATC. So thank you very much already, the speakers. If you have already any other question, do not hesitate to let us know. We remind also to keep the microphone switched off, and all the presentations will be then available on the website. So thank you very much. Fabio, I think you can start. So please, you have the floor.
Thank you very much, Sandy. I will share my screen, just a second for the presentation. Okay.
Perfect. Yes, we can see.
So, good morning to all. My name is Fabio Brescia. I'm working here from ProMIS. I'm usually dealing with Interreg projects, so European Territorial Cooperation. And today I will show you a brief presentation about the new programming period 2021-2027 of these particular programs. So first of all, just some information just to align our knowledge about European Territorial Cooperation, or Interreg is the same. First of all, my point is to focus on this word, that is CBC. CBC is the acronym of cross-border cooperation. You will see this acronym in my presentation, but in Interreg in general, generally speaking, this word is as an important weight. So the cross-border cooperation starts in the 50s. So in 1950s, when some spontaneous experiences among public authorities, such as municipalities and regions, started cooperating between for common problems. So in fact, some years later, in 1958, the first Euroregion, that was called Euroregio, was established, was legally established, and this region was between Germany and Netherlands. Some years later, so in 60s and 70s, some other Euro regions grow, involving, of course, other regions. For example, started the Central Europe, that is a Euro region that became a program for the Interreg. The Central Europe started had some privilege. This area was focused between Germany, Switzerland, and France, or the Northern Europe between Norway, Sweden, and Finland. So in 1964, the second Euro region was formalized, and this interregional cross-border region was between Denmark and Sweden. So with some years later, in 98, there was a very important event, the European Framework Convention that was held in Madrid, in which the cross-border cooperation was in a way formalized with the local communities and authorities. So 20 countries shared some legal framework for the cross-border cooperation involving sub-states, for example, regional and local authorities. As you can see from the image, more or less the whole Europe was involved. Then what happens in 1989? There was the fall of the Berlin Wall and the collapse of the Soviet Union. What does it mean? It means that Europe should focus on borders much more, on borders and bordering. So what Europe, what does it led? It led to the first programming period for the Interreg, that is 1989-1993. As you can see from this table, the first programming period was just from the countries that has a border in common, so the cross-border cooperation, and the resources, the financial resources for this first programming period were 1.1 billion euros, so very few amounts. Generally speaking, this first programming period, but also the second one, was much more focused on public authorities that can know each other much more better in order to starting a cooperation and in order to prepare the border areas to become a unique market, a single market. On 1994 started the second programming period that stands until 1999. Apart from the cross-border cooperation, why is important this second period? Because in this second programming period, the sea was considered as a border, and for us, for Italian partners, this news was quite important, because we can consider countries on the other part of the Adriatic or the Mediterranean as a partner in our project. And moreover, also in 1996 started the transnational program. In the following slide, I will present the transnational programs, what does it mean. The important thing is that we moved from the aim to develop the borders for a single market to develop a unique EU territory, so a unique identity for the whole European territory. The financial resources were in a way 3 times, much more than 3 times. Then we led to the other third, fourth, and fifth programming period, more or less were the same from 2000 until the last programming period that was just finished in 2020. What does it means? That we have the cross-border cooperation, the transnational program, but in these 3 periods we have also the interregional cooperation, the interregional program. We have here some important representative for the interregional programs, in which will involve the whole area of the whole EU countries. As you can see, the financial resources in these years improved until the last programming period, so 2014-2020, in which we reached the 10 billion euro as resources for the Interregs. Then we have the last, this present programming period. So in 2021, started these 7-year programs in which we have the cross-border cooperation, the transnational cooperation, the interregional cooperation as the previous one, plus we have the improvement. We have the othermost regions. I will present also what does it means as cooperation in othermost regions. So the financial resources for this last programming period were a bit less for the first time in the history. We don't have an improvement of resources, but we have 9.1 billion euro for this programming period. This is in this slide you can see how the evolution of the Interreg since the beginning until the last programming period. In this one we have the same legal status because we have our own regulation in the Interreg programs, but as I told you, the commitment budget is a bit less. But we want to focus on the last programming period because this presentation focused on the programming period 2021-2027. What is new in this programming period for the Interregs? For sure, first of all, we have the priorities because in this programming period, the Interreg programs focus to support the EU priorities. In the last programming period, we had 11 thematic objectives, while in this one, in this last programming period, we have just 5 policy objectives. Which are these objectives? For sure you know, because all of you manage projects, so it derives from the policy, the European policy. So the first one is a more competitive and smart in Europe. The second one focus on a greener low carbon transition towards a net zero carbon economy. The third one is for the mobility, so a more connected Europe by enhancing mobility. The fourth one, that is the one that is in a way much more important for us dealing with the health sector, is a more social and inclusive Europe. I don't want to say that we can implement project in health just under the fourth priority, but in this and social priority, of course, there is an explicit referring to health system, to healthcare in general. So in the last one is more focused on the governance, so Europe closer to citizens by fostering the sustainable and integrated development for all type of territories. Then we have the second point, what's new in this programming period, that is the simplification. For the first time, we can, as beneficiary, we can use a lot of simplification from a legal, legislative, and financial point of view. From financial point of view, for example, we can use a simplified cost option, as you can see on the third point, that can, in a way, that can be managed as project in a faster way and in a quicker way. We have also lighter and more frequent reporting. We can use a single audit principle, so also the audit part for our financial reporting is much more easier. So this kind of simplification led to a simpler project, so we can focus on technical activities and the impact of our project with the flexibility of the managerial part. Then we have the flexible programming adjust to the new challenges and emerging needs, and the reinforced visibility and communication provision. This last point is quite important for me, because we have to improve much more the communication part of the Interreg project according to the evaluation of all the programs, the evaluation of the past programming period. The Interreg programs developed such as a unique visibility, so we have same logos, same visual identities, also for the different countries, same colors. Of course, each programming has its own logo, but generally speaking, the idea to the use of colors, to the use of the icons is common for all the Interreg project. So, coming back to talking more generally about the Interregs, as I told you before, we have different type of Interreg programs, and so we can implement different type of Interreg projects, because the same project could be considered as at transnational level. For example, the transnational cooperation programs involves nation, regions, and local authorities, also including the cross-border maritime authorities. That can cover the cross-border cooperation. So we have a high level of territorial cooperation in these countries. We can implement, we can apply to cross-border cooperation programs. The difference is that transnational cooperation programs are wider than the cross-border cooperation one. Cross-border is just for the regions for the nations that have a border in common. A border that, I repeat, can be also the sea. We have some programs in the south of Italy, for example, in which the sea is the border. So it's not a physical border, but we can consider the sea as a physical border. Then we have the interregional cooperation, in which we involve the whole European Union, so all the countries dealing with the EU, that aims to strengthen the effectiveness of the cohesion policy, because all these programs comes from the cohesion policy, of course. And then we have this new thing for this programming period, that are the othermost region cooperation. I want to focus a bit on these regions, because are the new one. The cooperation of the othermost region is an innovative factor regarding the European Territorial Cooperation Objective that was introduced in this new programming period. And the aim of these programs is to facilitate the integration and harmonization at development level, at legislative level of some countries. Which are these countries? You can see are countries quite far from Europe, but in a way that are linked to Europe. We have, for example, we have Azores and Madeira that in a way are linked to Portugal, or the islands linked to France, or we have also Amazonia. I saw that there is someone from the Interreg Amazonia. Maybe we can have your intervention about these programs. So that is just an overview of the Interreg. I don't want to go in depth of Interreg project, because and in particular on health sector, because we will see in the next presentation some best practice, and most of all we can focus with Mrs. Asitores, that is a program manager of the Interact, how we can in a way exploit Interreg and European territorial cooperation also in the health sector, even if the health sector is not at the moment one of the most important priority, as you can saw from the previous one, but we can consider health as a sub-priority quite important for develop cross-border cooperation project in particular, because as you can imagine, health is strictly linked to the cross-border cooperation. If we have some borders in common, people can come from a country to another one to use the health system. Private or public, it is not important, but as you can imagine, health is a focus, a crucial point for the cross-border cooperation. So thank you very much for your attention, and I'm here if you want to, if you have some question.
Thank you very much, Fabio, for this first overview, very comprehensive as well. And thank you very much for highlighting also the importance of the communication as a new part of the program, because I'm sure we can learn from it. Also, just to mention that in the framework of the Joint Action National Focal Point, we are also working within the Work Package 5, synergies with other health-related programs. So we are developing a specific activity on assessing and mapping potential synergies at our national levels. Of course, not to mention that EU4Health itself is foreseeing the synergies with other health-related programs. I don't know if there is already any comment, any input, any feedback to be shared now. We have some time. We might be a bit ahead on the agenda, but I think it's not a problem. In the chat, or you can also raise your hand. You can also write it in Italian, and I will translate the question for you. If English is not maybe your main language. Otherwise, if not, if Johanna Stoger is ready to take the floor, I will just then focus on the next session.
Okay, thank you. So I will share my screen.
Yes.
Wait. So do you see it?
Yes, almost. Yes, perfect.
Perfect. Okay. So welcome also from my side. My name is Johanna Stöger. I'm working for the initiative Health Across, which is part of the health agency in Lower Austria. It's a regional healthcare organization who is responsible for 27 hospitals and 15 nursing homes. And the initiative Health Across executes and develops all cross-border project and European project in this area. Today, I'm going to present you one of our projects called Bridges for Birth. It was a cross-border cooperation in the field of healthcare in neonatology between Lower Austria and Slovakia. And to be more precise, it was between the Regional Hospital of Hamburg and the Children's University Hospital of Bratislava. So first of all, I want to present you some key facts about the program. The project took place within the framework of a cooperation program Interreg 5A between Slovakia and Austria in the funding period from 2014 to 2020. The project partners were the Health Agency of Lower Austria and the Regional Hospital of Hamburg. The Ministry of Health of the Slovak Republic as a lead partner, and the National Institute for Children's Disease in Bratislava as a strategic partner. The main objective of the project was to strengthen the institutional cooperation in cross-border regions between Austria and the Slovak Republic. Because it was an Interreg project, it was co-financed by the European Union with 85%, and the remaining 15% were financed through national funds, so from my agency. And in total, it was a budget of €426,600. Due to COVID, we have to extend the duration of the program. So it took place from the beginning of June until the end of October in 2020. So it was around 3.5 years. So where did we start? So in 2014, we already had cooperation with the Czech Republic, with the regions of South Moravia and South Bohemia. So it was only neutral that we decided to also draw attention to the border between Lower Austria and Slovakia in field of healthcare, because at this time there was no cooperation between these two regions. And this condition negatively affected the access and also the quality of health for people who are living in this area. So, for example, emergency units were not allowed to cross the borders in general, but especially in fields of neonatal emergencies, because all through the distance between the regional hospital in Hamburg and the Children's Hospital of Bratislava is just 16 kilometers far away from each other. So it's really close. But in case of an emergency, the newborns had to be transferred to an hospital 76 kilometers far away. And we all know that time in these cases is crucial, and it is an important health indicator. So the sooner the children receive care, the better the health outcome is. So with this in mind, we knew that we have a lot of things to do. The first of it was to create a framework condition for cross-border patient care in field of neonatology, to further improve the access to healthcare facilities for people who are living there. And due to the fact that it was the first project of its kind in this area, it was crucial that we build trust between these two regions. So coming in contact, networking was very important to guarantee a long-term cooperation between these two partners. We had 5 work packages next to the classic project management tasks like management communication. We had 3 main packages. And the third one was the development of a strategy plan called Cooperation Agenda. The aim of it was to identify health needs in this area, taking into account examples for good practice. So we formulate concrete short, medium, and long-term objectives for further cooperation potential, structured into 5 strategic fields of action. Around 30 projects were identified, and in an initial prioritization process, according to the expected improvements for healthcare of the population, feasibility and sustainability, 6 new project ideas were selected. The first one was the strengthening of the pediatric care. The second one was the development of an educational cooperation, then projects in field of oncology, then projects for low threshold access to health topic like prevention, cooperation in the implementation of fast-track process optimization, and projects in field of stroke and heart attack. And the 4th work packages was the rescue cooperation for transport of neonatal emergencies. As I told you before the project begins, it was not possible that rescue units cross the borders in general. And so it was important that we prepare a draft, a rescue draft, that it is possible that they can transfer the borders. And in order to know each other's structures and procedures, it was also important that the rescue units get to know each other in form of meetings. Due to COVID, it was only online possible. And the last point was the hospital cooperation in field of neonatology between the Regional Hospital of Hamburg and the Children's University Hospital of Bratislava. In regular meetings, physicians of both hospitals discussed which steps are necessary to guarantee a safe and high quality transfer of the newborns, and in order to create a transition from theory to practice, each step was previously tested, and they prepare a practical clinical cooperation for it. On these pictures, you can see all steps, the whole procedure from the emergency calls until the transfer, until the hospitalization of the newborns. And we transferred 4 newborns, so we closely reached the target of 5, but due to COVID, it was really difficult because, for example, 1 week after the first pilot transfer, the borders were closed, so it was not possible that anybody crossed the borders. So this is also why we extend the duration and had only 4 newborns that we could transfer. And after each transfer, we evaluated and made feedback loops to constantly improve the process. And also during the process, we imagined that there was a problem with the existing equipment. So we need new stretchers and also new ventilators for the rescue vehicles. So we bought them for the project. The closing conference took place on the 20th of September in 2020. And we are really proud of this project, and we want to further develop a good cooperation with the Slovak Republic. So thank you from my side. If you have any questions, don't hesitate to ask. So I close it.
Thank you very much, Joanna, for presenting the activities and the results of the project. I think it is a really useful and example to be shared. So thank you again. Thank you for highlighting also the need, of course, to develop a long-term cooperation, also the trust between partners, and also what I found interesting was the fact that, of course, it has been highlighted also the topic of health indicators as a way to focus further on the activities. Please do not hesitate again to raise your hand if you have any. Yeah, please, Mercedes.
Hello, good morning, everybody. I will talk later, but I would like to take the opportunity to ask Johanna. Well, I liked very much the fact of building trust, and I will mention that afterwards in my presentation. But what I would like to know, and also considering my future part, talking about synergies, I mean, have you considered do a second step of this project? Or, for example, has the regions or local authorities or, you know, Lower Austria or the Czech Republic assume what you have done in the project? Have they adapted some different, you know, something in their system thanks of your project?
I was talking about the rescue draft because it's also important that we put it into a legal regulation in the Slovak Republic. So there is already a draft at the Ministry of Slovak Republic. So they need to sign it that we can further make a progress in this project. Because the rescue...
Johanna, could you repeat the name or put it in the chat?
The Which one?
No, not the minister, what the ministry will get, the whole concept.
They get a draft for the rescue.
Rescue.
Yeah.
Okay, I will maybe
so
get in touch
that
with
the
you.
rescue organization can cross the borders, because now it's not really possible because we don't have a draft or a contract with the on national level. So this is what we need.
Okay. Thank you.
Thank you very much, Mercedes. It is indeed a relevant point to be shared. So thank you also, Johanna. There is another question from Team, National Focal Point from France, please.
Thank you very much. Thank you, Sandita. Thank you, Hannah, for this very interesting presentation. My question is a bit similar to the one of Mercedes. When it comes to sustainability of the project, we and the EU4Health program have a sustainability working package that tries to cover this. And I was wondering, besides the legal barriers that you were just mentioning, how could this cooperation continue after 2022 once you've overcome these barriers? When it comes in, for instance, for financial sustainability, how could this continue to run from a financial point of view and operationally once you have lifted these legal questions? Is this something you consider doing the project, or you continue bilaterally with the ministry? That would be interesting for us. Thank you.
So when it comes to the financial aspect, because the neonatal are emergencies, so the insurance of Austria and also from the Slovak Republic covers the costs for the treatments in Bratislava. So there is no problem. And a lot of mothers are from Slovak Republic. So there's also no problem with that. And but we are not really sure how to continue after the legal regulations. So we have no exact plans, because for us, the important step was this draft on a national level. Yeah.
And if I may ask, like expenses when it comes to not the insurance companies, but more expenses, projects-based expenses, like for instance, material that has to be bought or sustained, personnel that has to be maybe recruited or paid. Would you have to come up with your own costs, or do you look for other European funding in order to assure that this cooperation after the end of the project?
We hope that we get other European funding for our next project, but also from our organization, we try that the project also extend financially. But I think, what was I saying? Yeah, we tried to do another Interact project with it, but my colleague knows a little bit more about it, so I'm not sure how ready we are with the exact plans for continuous.
Thank you, team, for the relevant point. I think it is an example indeed of how, let's say, the activities, the results of such an important project could then have an impact on the national legislation and on the implementation of the program, let's say, at the national level. So it is indeed something that we are also working within the joint action. Johanna, maybe we can ask, if possible, to share the presentation with us, and if there might be any other, let's say, questions from our side, maybe we can reach out to you and your colleagues, if possible. Okay, so thank you very much. I don't know if there are any other questions. Otherwise, I think I will give the floor to Mercedes for the next session. And we will share your presentation.
Thank you. So my name is Mercedes Acitores. I work for Interact. I'm the team leader for Inclusive Growth Network. which is the network that deals with social policy. And only since Fabio did a wonderful presentation on what is Interreg, I was a bit scared that I will maybe, go back and mention some of the things, but that he mentioned, but I think it won't be a problem. It's better even for you to settle some of the basic knowledge. Just to tell you that Interact is one of these Interreg programs, but we don't finance any project. What we do is support the programs. That's the reason we have an overview, overall overview on what's going on. And some of us were dedicated to some thematic issues. For example, inclusive growth, we deal with health. So just to start, I think that what Tim raised and was very interesting, also because of the concern, and this is a bracket, but something that we need to take into account, the concern of what's happening after the project, sustainability of the project. He mentioned something about a sustainability package, which I don't know. I would like to know more. Maybe afterwards he could mention something. But we have to think what we are going to do after these projects. And for Johanna's information, in the program Slovakia, Austria will have a path for access to healthcare. So there you have a fund, a possibility of funding and to continuing there. But honestly, we, even in Interreg and in other kind of funds, EU4Health, for example, or others, we have to think of a time that results will adjust. And for example, when this draft, they did this draft, they gave it to the Czech colleagues, and then it needs a follow-up. And who's going to pay this follow-up? How is going to be financed? And this kind of follow-up is not a half-a-day work. It can be really full-time work to follow and to adapt these systems. So only this is something that it's a really interesting concern, and I fully agree with Tim's question, and maybe afterwards we can discuss that. And it's not a need only for Interreg, but it's a need for the whole EU funding to consider what happens afterwards. So this is a little bit of structure in order for you not to, to be lost. So you can follow me. I will do some basics. First of all, I'm working on synergies, not only on thematic wise, but also geographically wise. And we see that, as Johanna mentioned before, first of all, to work on synergies. No, previous slide. Thank you. The first one, exactly. We need to share information. So if I want to work in synergies with you, you need to know what I do, and I need to know what you do. If not, it's impossible. For that, and then build trust, because if not, we won't work. We will have information, but we won't really work on synergies. Then I will go and do a small introduction again, but shorter, on Interreg 2021-27 and what's in, then I'll go to Interreg support to access to healthcare in period 2014-2020, some recommendations. And sorry, I was confused in the slide. The introduction will be 2014-2020, and then afterwards I will go to 21-27, and some tools maybe for you to use in order to, improve synergies. And I will just share with you 2 tools that we have in Interact, so you know more about Interreg. Now, yes, let's go to the next slide. Thank you. So already Fabio did a very good, historical background on what is Interreg. He even showed this evolution of the different programs in different periods. I won't focus on this slide very much. Only already that the budget, it's 10 billion euros, including the partner countries. What is new in this programming period, as I think Fabio already mentioned, is that the next programs, what is now considered ENI CBC, are included in the Interreg family, as the IPA programs are also included in the IPA in the Interreg family. So although we will have a little bit more of maybe the budget, but there are more programs to cover. So all in all, we will have less money in Interreg than previous periods. That's the reason and the need of synergies. If we don't have money, we need to get the most of it. and getting the most of it is thinking in a strategic way and considering other funds to find complementarities and to establish like a chain of projects that will improve the needs that we have in our area. Again, we are talking here not about themes. We are talking about territory and cohesion policy. This is important because although we will maybe tackle similar topics, we will approach them differently. And there is where we have the complementarity. Please, next slide. Okay. About what's new in 21-27. Fabio mentioned simplification and flexibility, so he mentioned few actions regarding that. I will be much more broader or general. Then the idea of working in synergies. I mean, in all our regulations, the need of working in synergies among Interreg programs and with what we call mainstream programs, which is ERDF, ESF. It's a must, but not only with us, but also thematically with the direct management programs, as for example, EU4Health or life in other kind of topics or Horizon. So there's a need to see what others are doing and what is a place in Interreg to complement that and the other way around. As I said, full integration of external borders. We have the outermost regions, who are these programs that are in part of EU countries, but outside the EU geography. He mentioned, I think, Amazonia, or there are 5 or 6 programs. Their full integrate is one of the strands, together with transnational, cross-border, and interregional. But also next, which was the formal ENI CBC, the neighborhood programs, and the pre-accession programs. Key words: Green Deal, recovery, and United Nations Sustainable Goals. I think that's in common for all the the EU funds. Or strand, I mentioned already, and co-financing can be up to 80%, and some up to, that means not always will be up to 80%, because maybe the programs will decide to have a less co-financing, but the regulation will allow to go up to 80% and 85% for the outermost regions. Next slide. Okay, so Fabio already mentioned the objectives. Here are the 11 priorities that we had in the past, and now they are 5 plus 2, specific for territorial cooperation, which is better cooperation governance and safer and more secure. Where can we find health? We could find health, of course, in more social inclusive, but here there will be a specific objective dedicated to access to healthcare. So it's not only health, but access to healthcare, and that will be dealt in more social and inclusive Europe. But there are some innovation kind of aspects that could be, that health could have, and could be dealt in more competitive and smarter, or maybe public and private partnerships could also be included in more competitive and smarter Europe. Or maybe we can consider training or scaling up some services, the public services in the public sector, and that would be more in the better cooperation governance. So as he mentioned, the more social inclusive and inclusive will be the main topic, but especially for access to healthcare. But health could be tackled in other funds, objectives. Next slide. Okay, so here we have some general information. We mentioned that there are some strands, as we said: transnational, cross-border, pre-accession, and neighborhood. And all in all, we see that there have been 107 projects financed in the previous programming period on access to healthcare in Interreg. So there's quite a lot, and up to almost 222 million euros, which is quite a lot too. Of course, if we maybe compare it with, you know, social fund dedicated to health, it's not that much, but here we have to think of this cooperation component. And a very good, clear example was the one Johanna mentioned before. Here also you can see a map. Where are most of them developed? And you can see that Southwest Europe, that not much developed, although there's a very popular project about the Sardinia hospital in the cross-border with France and Spain and Andorra. But you could see that it's focused specifically in we could say North or West Europe, where most of the projects will be dedicated to innovation. That's something that we checked in our report. And then we can see the eastern part, and although here seems a bit scattered, but there the Balkan areas and pre-accession, where most of the projects will be dedicated to training, and will be also to health provision, to services. So we can see there are different kinds of projects in one area and the other. Next slide, please. Okay, so based on this report analyzing these 107 projects, and again, I repeat, it's access to healthcare, okay? We could see, which is much more from Interreg, of this especially border relationship. We could see that there are four major clusters, which it was very hard to do this classification because sometimes, you know, one project can be dedicated in social inclusion, but will have an innovation component. But all in all, and mainly, we could say that there were some health provision, which refers to projects supplying healthcare services in areas where they lack or need improved equipment or specialized diagnosis and treatment. Then we have social inclusion, we have innovation, training and networking. And then as cross-cutting topics, we will have capacity building, which will be in all four. The use of ICT tools will be in all four, and awareness raising. I think this maybe to mention that, yes, I think this is enough, and then we will go to each of these projects. Oh yeah. Sorry, I'm just taking my notes. You can continue. Thank you. Perfect. So here we have health provision, and I said as health provision refers to supplying healthcare services, as I said, where there's a lack, as Johanna mentioned, there was a lack in their border, and that's the reason we have B4B bridges for birth included in this group. Of course, doesn't mean that they don't do other kind of things, but mainly could be this kind of a project that would be considered healthcare provision. We also have another project called, well, there are examples. There are many projects. We only highlighted some good examples. We have NUMA, who's in the area of Spain, Portugal, and Andorra. And the NUMA, it's promotion of a new healthcare model based on a stronger coordination between cross-border healthcare services and citizens through data collected by pharmacies. So here again, we have this complementarity with ICT devices to improve early diagnosis, care and monitoring of patient conditions, also at a distance. You can see that very similar kind of projects. Okay, so this would be, again, healthcare provision will focus on increased institutional cooperation across borders and set the conditions for improved healthcare governance and services. Okay, so next slide. And here you can see the area where more healthcare provision projects will appear. Then we have innovation. Innovation here includes projects dealing with different aspects, such as developing new health technologies, new products, procedural processes, proposing innovative solutions and organizational models to improve healthcare services. Here also we will see that innovation will try to promote cooperation between SMEs and research and development centers and higher education institutions to develop new diagnosis and treatment methods. You can see here most of the projects are up north. There are some others in Central Europe, but most of them are focused on north, because I come from Spain. We could consider this West Europe. Sorry. And here we have two examples: Mediwarn and Bone. Bone is dedicated to biofabrication of orthopedics in a new era exactly. And I'm not telling more, maybe because there's a documents that I can share with you afterwards, and you can read them. Then we can go next slide. Social inclusion, and here the social inclusion covers projects fostering access to healthcare for vulnerable groups. And here we say children, elderly, migrants, people with different abilities, but also people living in peripheral areas. This is something that more and more is coming. I mean, the rurality in the healthcare system. These people are sometimes obliged to travel across borders to reach their services with sufficient quality. And Interreg is a program that really could help to develop this. Okay, and some examples. We have here an example of Latvia, Lithuania, and Belarus. This is the better access to specialized healthcare services for elderly population of Godno and Utena counties. And exactly, and well, as I said before, you could check more information in the report that I will share with you. And then we will have here Babies Across Borders, which is not far away from the one Johanna mentioned, but maybe with this is in the area of IPA program. It's in Romania and not IPA, but eastern side, Romania, Hungary, and it was very dedicated to maybe the rurality of this area. Okay, and finally, next slide. And then we will have training and networking, whereas here we have two examples, Thoro and Teledoc. I could mention some things about Thoro. Here was focused on aging population, and where they were training young people on how to, on the home care, self-care via apps and giving innovative solutions to elderly, and also mixing a bit the not elderly being on their own, but also combining elderly with healthcare problems into homes where childcare. So there's also this, although it's training, but there was also a social inclusion or a social component. So elderly won't be on their own, but they will share premises with childcare. So things are maybe from a different perspective. And yeah. So next slide. So here we were talking about complementarities and synergies, and we did an analysis on what would be the complementarity between Interreg and ESF Plus and EU4Health and Horizon Europe. And in general, maybe I would like to highlight, because that's for sure that in order to be more efficient, we need to check what others are doing. And healthcare, as I will tell you maybe later on, it's been one of the topics. Now a third of the programs in Interreg are tackling healthcare, probably based after the pandemic. We saw that huge crisis, not only from the health perspective, but the health public service perspective. So for example, here we analyzed a few themes. I would like to focus on EU4Health, and also my interest here was listening somebody from EU4Health, if we got this right, because if not, we are not able to work in synergies. And this is also something that we would like, talking about sustainability, Tim, as you mentioned, you know, the fact that maybe a project has been developed by Interreg, it could be then inspiring for another kind of fund, and will make possible this kind of sustainability. So here well, EU4Health is direct management, so it's the European Commission who deals with it, while in our case there are different regions, which is a bit of a nightmare, but this is the case. You have to know which program it's for you to see what kind of topic they will be financing. So even though we know that the third of the programs in Interreg will deal with access to healthcare, the specificity, you need to contact each of the programs. I saw here that EU4Health was also considering cross-border health threats. I would like to know what do we mean with cross-border, because sometimes we use also the same names or the same wording and we mean differently, and we are in meetings and we don't understand each other, but because we don't understand what's behind the word. Exactly, I mean, about different main themes, I could see that some of them could be common, but I think the major ideas here is the cross-border health threats, and I would like to have the possibility to talk some of the colleagues of EU4Health. And then next slide. Okay, and okay, I hear there are two tools that could be useful for you. Since I'm not controlling the my presentation, I'm not able to open it. I don't know if it's possible for you to click on keep.eu and open. Maybe yes. If not, you will go on your own, or maybe we can put it in the chat. I mean, there you could find, if you don't know, all the projects that have been financed so far, even the 21-27 projects that are being financed. And you could see a description of the, thank you, Sandita. So each of you could go. You could see what you have to put only in the keyword health or healthcare. And then you could see all the projects that has been financed so far. You have to choose also the programming period you are talking about. And it's very general information, of course, but it's information. And I think this gives you an idea afterwards to approach the program or the project. And then we have the other tool, Interreg.eu, where you could find also, please, if you, Sandita, you could put it, there's a possibility of check on calls. Sometimes it's not 100% updated, but you can check, putting the topic, if any program has a call open. So I think there's a last slide, if I remember well. Yeah, some recommendations. These are recommendations coming from the report of 2014-2020. Again, the idea of take advantage of the complementarities with regional, national, and EU programs, and EU level programs to continue developing healthcare provision, social inclusion, innovation, training, and networking. So, I mean, the fact of not having that amount of budget has to make us, we have to be innovative, and social innovation should be included in our ways of doing things. Developing synergies, as I said, not only across Interreg projects that we are working on that, but also with you, with other funds. And I would also, in this regard, and with these 2 points, maybe in your regions, I don't know the kind of colleagues that we have there in the meeting, but in your regions, check which projects are being financed. Most of the cases, the ones they know, Interreg projects, are those in the Treasury Department or Regional Ministry, who are dealing with ERDF, but talk to them and see really what are they doing in order for you to know and to create like a pool of information on what what's being done in your area, because data, and I don't know if I wrote here somewhere data, but data is so important to take decisions. And sometimes we need time to see what kind of information we have in our area without having to finance, but knowing what others are financing. So it's just creates a different way of doing things and see what in your area is being financed in the topic of health. Organize inter-program thematic meetings, of course, encourage project actors to answer new needs such as mental issues. We saw that there was in young people, we saw that mental issues were raising more and more and more in the projects as a topic, as a specific topic, and this is one of the also an idea for Interact to cover that. And adopt, as I said, adopt a more structured territorial approach by creating functional cross-border public health services when possible. But as I said, it's just knowing what your area is doing without you necessarily being financing it. I don't know, maybe there's a last slide for 21, 27, I think, yes. Oh, no, not yet. Here you can find in interact.eu the publications, a full report. We have one of healthy and active aging and another one, access to healthcare. This is the one, and also a video. So you just can interact.eu. And you have to go to Inclusive Growth Network in the network, because if not, it's a mess trying to find our kind of reports. I know. And then next slide. Okay, thank you for your attention. Let me then tell you, I didn't prepare a slide, but for 21, 27, I said already that 30% of the programs are financing access to healthcare. Then there are already 2 programs that are working on it, and they already they launched some calls that you could see it in Interreg.eu. It's Interreg North Sea and Interreg Sweden, Denmark, and Norway. Topics that they are addressing: aging and demographic challenges, diabetic and celiac diseases, rare diseases, cancer, apnea, reorganization of healthcare systems. These are the 2 programs that they have launched already, projects, and they're running. Okay, that's all. Thank you very much for your attention. I hope that I didn't bore you too much.
Thank you very much, Mercedes. Definitely, it was not boring at all. It was very useful. Before commenting for my side, there is a question in the chat. Are there any best practices, project examples to share that started with Interreg and then were funded by ERDF funds, so European Regional Development Funds, in the regions, in healthcare provision, services, or innovation?
Okay, not that we know yet, but this is something that really because there are, I'm sure there are, but it's something that we need to check on. But exactly, program per program, who asked the question and where is this person from?
Please, you can take the floor if you want.
Mike?
Yeah, it's Mike Savarese from Schumann Associates. I'm based in Italy, but I work with a consultancy in Belgium.
Okay, no, I was asking just in case, maybe if we could ask the programs that you are maybe, but if you're it's in general, I want to know some. I'm sure there must be, not maybe that much in ERDF, maybe ESF plus or something. Yeah.
Okay. Then there is another question. What about the eligible subjects and proposal evaluation criteria? What about the evaluation and approval processes? And then who are the appointed national contact points? With regard to the national contact points, we as ProMIS, let's say we are in contact with them. Fabio is definitely more an expert on this. So let's say at the national level in Italy. I don't know if you, Mercedes, do you want to take this question about the evaluation criteria or processes? Otherwise, we can eventually reach out to you at a later stage.
I mean, when they talk about the evaluation, what do you mean?
I think it's about the process of submitting
Assessment criteria. Assessment criteria.
Ah, well, this is how
the
you call it.
evaluation of the proposals.
Yes, but that will depend on each of, if it's in Interreg, what you're talking about, that will depend on the different programs. They will have different assessment criteria. There's a basic, which is there's a template in general, but then each program, since they choose what actions or what line of actions they will finance under each of the specific objectives or policy objectives, then they will assess accordingly. So for example, Alessandra, I think you shut your, where are you from?
Italy.
Italy, but
Italy.
okay, but then we would have to check on which region of Italy you're wanting to know this information, because the assessment criteria can be very different from one to another.
Piedmont.
Yeah. So we
North.
have to pay Alcotra, for example, or Alpine Space. There are a few programs that could that your region it's involved, and you are able to ask for financing but in each of the programs their assessment will be different. There are some criteria like cooperation, like that they are general, but more in relation to or innovation, for example. But what is in relation to healthcare, you have to contact to the different managing authorities.
Thank you very much.
Fabio wants to add something more.
Thank you, Mercedes. Nothing to add, obviously, about this. Each programs at the beginning of the programming period publish their program manual, in which you can find which are the priority axes, the thematic objectives, suggested activities, expected results, and so on. So in that case, you can also find some criteria evaluation that you will find in the specific call. Different type of calls could be different evaluation criteria. For example, strategic projects doesn't have the same evaluation criteria of the standard project, or the small scale one have different evaluation criteria from the standard one. Maybe I'm a bit too much
Because in each program they will call us strategic different. So for one area, strategic is one thing, and another area, strategic is another thing. So I think that it's much better if they go to the website, and normally the assessment criteria goes together with the call. So the topics you will know in the cooperation program, which is published, and then when the call is launched, you can see the assessment criteria that they will apply for that specific call.
Yeah, I would also add something in the previous question about a possible best practice, which started from an Interreg project and then have been financed by their own funds or ERDF funds. I have a best practice. I mean, I know a IPA, Italia Bene Montenegro, that is the previous program. The name of the program now is South Adriatic, but it's an Interreg program in which Molise region, Puglia region from Italy, and the whole country of Albania and Montenegro are eligible. This project is named FACE, and this project aims at transferring the good practices of the management of emergency to Albania and Montenegro. In particular, with the funds of this IPA project, project partners from Albania create a control room for their emergency center. They have just one emergency center in Albania, so they both from project funds all the equipment for this control room. So the project financed the equipment. Apulian partners went there to in a way to train, to exchange their knowledge and their competencies, because in Puglia, as you know, and in the whole Italy, there are control rooms from years, so we know how to manage this kind of emergency. So we train doctors, nurses, and so on, and technical staff, of course. And then the government decided to finance the continue of this control room in Albania. So right now there are some control rooms in Tirana, in the capital, financed by the IPA program for the equipment and finance for the doctors, the cardiologists, and so on by the government. So this is an example starting from the Interreg and then financed by the government. You're welcome.
Thank you very much, Fabio. But we will look for more because there must be, and surprisingly, we have to really enhance that and promote those examples. Thank you so much.
That's super interesting. Thank you.
Thank you very much again. I don't know if there is any other comment. In the meantime, again, I would like to thank very much the speakers and Mercedes for the last presentation. It was very interesting to have this specific overview of the thematic clusters, and also it was interesting to see how, let's say, the projects that you've been sharing as an examples are actually working on the reality on that specific, let's say, cross-border. And it is interesting because, of course, we are working, so just to provide you a few information more, we are working with all EU4Health national focal points, so we are working towards the implementation of the EU4Health program at the national level. But of course, maybe we have more of a general national ecosystem overview, but then it was interesting that still with regard to specific health thematics and challenges, then this program are working and tackling those let's say specific problems. With regard then to the sustainability, so we are having a specific package, work package number 4, sustainability of action integration into national policies. As let's say, also one of the results and outcomes will be to develop a sustainability plan with regard to the network of the national focal points that we are trying to reinforce more and more. And specifically also France, the Minister of Health in France is leading a task with regard also to the cooperation with the EU level stakeholders. I don't know if also Tim, if he's still here, wants to take the floor. We are anyway happy to share with you more, Mercedes, if you need further information of on our project. And you can reach out to our website as well. Also, colleagues from our package 3, they have shared the survey that we kindly ask you to answer. It will not take a lot. It is important for evaluating our project. If there are not any other comments, we are 10 minutes ahead the agenda, but we can finish earlier. Okay. So thank you very much. Again, all the materials, also a report, a summary report will be produced. They will be available on our website. And do not hesitate to also follow us on our social media channels so that you don't miss the next appointments. The next one is end of May. So we will be opening the registration soon. Thank you again to the speakers for the comprehensive presentation. It was really, really interesting for us and for our activity, and I'm sure that there is so much to learn. Thank you. Thank you, everybody. Bye-bye. Have a nice day.
Thank you, Sangeeta. Bye.
Thank you very much.
Bye bye.